So I'm just keeping an eye on time. It's 10:32, and I want to be really mindful of everyone's time, particularly as we're super busy doing the best we can for public health and safety in the community. So I'll remind folks, and some folks did just arrive to this meeting space. My name is Mary Parrish. I'm the Public Information Officer for the Health Department's COVID-19 response. I also serve in an accreditation and workforce development role. And I also am associated with the University of Montana's School of Public and Community Health Sciences. And so I'm very excited to facilitate this EPI press conference today. I want to let everyone know that this is being recorded, so you will be able to access this information later, and your peers and colleagues will be able to access information later too if they were not able to attend in real time. Before we really get started, I will remind everyone again once more, please check those microphones and mute them. Just really helps to reduce background noise that might affect the clarity of the presentation. So let's check those mics, and if you are amenable, I also ask you to turn off your video because that helps with the overall streaming quality of this presentation itself. And yeah, before we get started, what's going to happen is I'm going to introduce all of our different speakers, and then I will hand over the reins to those wonderful speakers, and then we'll wrap up with some questions and answers that will be facilitated by me. And just going to plant the seed now for that Q&A. Playing around with Zoom this morning, I noticed that there is a raise hand feature. So if you are interested in asking a question, if you click on the participant icon on your toolbar, it opens up a separate little tab window. And below the list of participants, you'll see the option to raise your hand. Another thing that we can do is...
Did I not? She's like, if I don't get this test...
Someone's microphone is not muted.
I totally knew it.
I wish I don't have the capability to mute someone, or I would. But please check your microphones, especially if you're in a space with more than one person, as we are hearing your whole conversation. Thank you so much. So really quickly, you click on the participant icon at the bottom, opens up a new window, and you'll see that you have the raise hand feature. So when we get to the Q&A, we can use that. We can also make use of the chat box just to kind of facilitate speaking one by one. So today we're going to hear from Dr. Erin Simmons, who works at the University of Montana as an epidemiologist. And then we're going to hear from Dr. Ethan Walker, who is also associated with the University of Montana. He's a postdoctoral researcher. Then we're going to hear from Christy Scheel, who works for the City County Health Department. She is the Situation Unit Leader. And then from Rebecca Elderkin, who is also associated with the Health Department, and she is a COVID data specialist. And then Cindy Farr, Incident Commander and Director of the Health Promotion Division at the Health Department, will be providing some concluding thoughts, and then we'll push into the Q&A. And so with that said, I will turn over the reins to Erin. Thank you, Erin.
Thanks very much, Mary, for the introduction. If you haven't joined one of our EPI Situation Unit press conferences before, this is our usual crew. So this group and others meet weekly to discuss epidemiologic data and interpretations. And today we'll be providing you with our most up-to-date results. And so with that, let's go ahead and get started. So last time our EPI Situation Unit held a press conference back on August 19th, the status of COVID in our community was relatively stable. And we indicated then that we were not out of the woods yet. We did not, and we do not have a vaccine or a treatment. So we knew COVID wasn't going anywhere. So the stability we saw a couple of months ago was fragile, and we can see that now very clearly. And so today we'll present information on the status of COVID in Missoula over time, as well as data on new cases and testing. And for the first time, we're in a position in which it is important that we feel it's important that we discuss public health and healthcare capacity because of the number of cases, contacts, and hospitalizations in our community. And finally, we'll close with some recommendations. And with that, now Ethan Walker will take over and introduce some of our data.
Great, thanks, Erin. So I'm going to start by just showing the full epidemic curve for Missoula County since the beginning of March. So this is to give the outbreak some context and just highlight some key days and events. So with this context, you can see that early on in the outbreak, cases relative to what we're seeing now were pretty low. It looks like closing schools and businesses was fairly effective in stopping the rise in cases. And then what we have seen since after the phase 2 reopening that occurred statewide, we've seen cases start to go up in Missoula County and towards the middle of June, and things kind of plateaued for a while. And then after Labor Day holiday, we really saw this dramatic rise in cases that we're currently experiencing. And this next slide is just zooming in on the latest data since August. And now you can see that, again, highlighting the Labor Day holiday, that's when we really started to see this increase in cases. However, we can't really say causally if it was Labor Day travel and interaction that really led to the rising cases. It was likely a combination of things, such as schools opening in August. UM started campus, students and employees back to campus in August, as well as that Labor Day holiday and travel and just a general mixing of the community after these events. So it was likely a combination of things, and we're likely to see similar things continue. And especially moving forward, looking at holidays coming up, things like Halloween, Thanksgiving, and Christmas. Not only are these popular times for gatherings and travel, but they also occur during this colder weather we're starting to experience. So they're going to be indoor gatherings. And when gatherings occur indoor, there's going to be a higher possibility of transmission because there's less ventilation and there's more close contact. So it'll be important going forward to have individual plans in place just to remain safe over those holiday periods and in those family gatherings. The next slide here is showing the rolling 14-day effective R numbers for Missoula County, and this is since the beginning of August. You'll also notice on this figure that it only goes up to October 9th. So this is due to incomplete case information over the past couple of weeks. We kind of have a 2-week cutoff period there. So remember that effective R is showing the transmission of the virus in the community at a particular point in time. So how many people on average are infected from a single infected individual? And this figure is highlighting, it kind of mirrors what we saw in the previous slides from the epidemic curves. Things look pretty good from August through early September, but shortly after Labor Day, we saw this really dramatic increase in transmission of the virus. So thankfully, since then, it's gone down just a little bit. However, you see the line on the one on the y-axis there, and that highlights really kind of this cutoff point for R values, where if the number is above that 1, then that means the virus is still transmitting and spreading throughout the community. So we're still above that important line at number 1. So it's important to keep an eye on this because this number can change quickly and dramatically as we've seen in the past. On the next figure, I want to talk a little bit about highlighting different age groups and who's been most impacted, especially during this last increase in cases. So this figure is just showing total case numbers by age group from the beginning of March in Missoula County. And as we've seen all along, the highest case numbers are typically in those lower age groups. You can really see distinctly that the 20-somethings have the highest case numbers total, but this doesn't really tell us the whole story. So looking at incidence rates, this gives us a much better picture of what's actually going on by age group. Remember, incidence rate is looking, in this case, at the rate of cases per 100,000 population. So it's the number of cases we would expect within an age group if they all had the same population of 100,000 individuals. And what this figure is showing is that, yes, the 20-somethings still have the highest incidence rate, but other age groups, particularly highlighting the 80-plus age group, have proportionally a very high incidence rate compared to what the case numbers look like. The 80-plus age group has been impacted on a similar level to those like the 30-something age groups. So this is an important factor to look at going forward. And lastly, this is another way to look at incidence by age group. This is looking at it over time. So we're taking cases since the beginning of August and looking at the incidence rate by age group for each week. And what you'll notice is during this recent increase in cases that there are these 4 distinct age groups that really stand out as being impacted most. So we have the 10 to 19-year-olds, the 20-somethings, 30-somethings, and then the 80-plus age group is kind of another distinct age group that we see in this time frame. In fact, the 80-plus-year-olds have, in the last couple of weeks with more complete data, they have the highest incidence rate in Missoula County. So this will be an important trend, particularly because the 80-plus age group is more at risk for hospitalization and subsequent death from infection. And all in my section here with just looking at some comparisons from Missoula County across the state and other counties with similar population size. And this figure is looking at the average number of new cases and incidence rates reported over the past week. Counties with the darker shades of blue have higher incidence rates. And so what we see here is Missoula County currently has a lower incidence rate than the state. So Missoula County incidence rate is around 36 right now, whereas the statewide, it's around 60. Gallatin County is seeing an incidence rate of around 50, and then Yellowstone around 74. It's important when looking at these comparisons, though, that these can change dramatically and very quickly. So, it's important that we're not getting complacent at a time like this. And we'll emphasize numerous times today how we're going into the winter season where there's more indoor interaction, how we're going into cold and flu season. So these numbers can change in a hurry, and it's just important to have a plan going forward for the winter and the holiday season that's upcoming. And with that, I'll hand it over to Christy, who will talk through some more recent active cases in the county.
Hi there, thanks Ethan. So staff at Missoula City County Health Department have recently created a new website, missoulainfo.com, where the public can find COVID-19 information and resources. And much of this is Missoula specific. And you can find everything from testing information to mandates and orders to the most recent data. Data tab at the top takes you to the Montana Department of Health and Human Resources COVID map and dashboard, Missoula County data, University of Montana data, as well as more in-depth epi reports. And then if you go ahead and switch, click on the Missoula County, click on Missoula County under the data tab, a dashboard pops up with all the most current case information. And this is usually updated by about 11 a.m. each day. And this is just a screenshot. But today we are reporting 89 new cases since our last update yesterday, which is our record high new case load per day. We are reporting 634 current active cases, 1,871 cumulative cases, 1,228 recoveries, 9 deaths, 12 Missoula County residents hospitalized, 11 out-of-county residents hospitalized. The dashboard also includes figures showing current COVID-19 trends in our community. And one of the important data points that we do like to track is the daily new cases per 100,000 Missoula residents over time. And this allows us to really understand how much the disease is spreading relative to population size. And as Ethan went over, we really saw a steady increase of new cases in September, and then a rapid concerning uptick by that first week in October. The trend line for daily new cases has remained above 30 cases per 100,000 for the majority of October. And the 7-day average currently calculates today at 44 new cases per 100,000 residents. In comparison, the daily new case average per 100,000 residents for August was 4, and then for September, it was 12. One pretty remarkable trend that we're seeing is the change in age distribution for active cases. Here's a snapshot from about 3 weeks ago, where we saw over half of total cases falling in that 20 to 29-year-old age group, and only 5% in the 60 and older. And then we go 1 week later, we see a shift. 20-somethings decreased, and the proportion of 60 and over almost tripled. And then on October 13th, we saw this trend continue with another drop for the 20 to 29 age group. And then in today's report, we see that 20% of all cases, total cases, fall in that the age group of 60 and older. And that is a 300% increase from just three weeks ago. This is obviously a really concerning trend, as older age groups are more at risk for COVID-related complications. And as a result, this increase in the 60 and older age group, we're seeing more COVID-related hospitalizations. You can move to that, yeah, great. Since Missoula is recognized as a regional medical hub, we track hospitalizations for Missoula County as well as non-residents. Most of the out-of-county residents are coming from adjacent counties to Missoula. And currently, there's 12 Missoula County residents hospitalized for COVID-related complications. And since August, we have more than doubled our hospitalizations, our current total of 70 since March. Active hospitalizations have also tripled in the past few weeks. So, we've learned from similar trends elsewhere that the impact of older people becoming infected can have pretty devastating consequences. We have seen just in the past 15 days, 6 of the 9 total deaths related to COVID in Missoula have occurred. If this trend continues with increased case counts among the older folks, we do expect to continue to see an increase in hospitalizations looking ahead. And unfortunately, with increase in hospitalizations, we also may see an increase in COVID-related deaths.
Thank you, Christy. Hello, everyone. So analyzing the testing numbers with the positivity rate gives us an opportunity to take a step back from looking only at positive cases and take a wide view of what's happening with disease spread in the community. For example, 100 positive cases found within 1,000 tests tells a very different story than 100 positive cases within 10,000 tests. So the positivity rate compares the number of positive cases to the total number of tests conducted. And you can see here in blue the total number of test events from last week, and then in orange the positivity rate. And our 7-day average last week was 8%. So you can think about it like 8% of the tests were positive. So you can go to the next slide. I like looking at the 14-day positivity rate because you can see how the positivity rate can be pretty variable based on the number of tests conducted. So what this average tells us is we need more testing. The CDC recommends that high positivity rates indicate the need for more testing. You can also think about this rate as the likelihood that there are more cases than we're finding through testing. So this is an important reminder to community health and the community at large to get tested if you can. And then finally, we can compare our positivity rate from last week, 2 weeks since the beginning of March, where you can see that testing numbers have increased, largely until last week. And you can see that despite an increase in testing, we're seeing that growth in cases. And from here, I will pass it to Cindy.
Thanks, Rebecca. So I just want to talk a little bit about public health capacity. Right now, I think everyone knows that with this huge increase in cases that we've seen over the last couple of weeks, it's taking us longer to perform our duties for contact tracing. And while we're onboarding new staff, we are also bringing on staff that have not been part of the incident and doing some just-in-time training to make sure that we're trying to get caught up. But I want to talk a little bit about how that process works. So when we get a new case and a new case is identified to us, we start with case investigation, and our staff reach out to that positive case and they talk to them about the different kinds of activities that they're involved in, and do they go to school, and where do they go to school, and where do they work? Do they live in a home with a family, or are they living with roommates? And we start to figure out who may have been in contact with that person while they were contagious. And we have them compile that list of people with their telephone numbers, and then it gets passed to contact tracing. So contact tracing starts making those telephone calls to all of those contacts. Sometimes it can be only a couple of people that have been exposed during that infectious period. And sometimes due to the nature of different people's jobs or their interactions at school, we could have upwards of 50 people that were exposed during that process. So the reason that this is important is that as we are having more and more contacts, it's really important for people to try to keep that social circle really small, because it takes a long time for us to get through. I mean, I believe the numbers today that we have over 1,500 people who have been identified as close contacts. That's a lot of phone calls that have to be made. And it takes a long time for us to get through all of those steps. The reason that is important is that the faster that we can actually make it through those steps and get a hold of those close contacts, the faster we can get them into quarantine, so that if they do develop the COVID disease, then they're not spreading it to other people before they actually develop symptoms. So next I want to talk a little bit about testing. So we do have some expanded testing capacity, but we also have increased demand. It's currently taking anywhere from 24 to 72 hours to get test results. Usually it's coming in at about 2 days. So that's really good, but we know that, that can fluctuate depending on lab capacity. We do still want to encourage everyone to get tested. You're not going to be taking a test from someone else. If you are having symptoms, you need to get tested. This is the way that we are going to get control of this outbreak at this time, is to get people tested. So we just want people to know that there is increased demand, but we do have the testing capacity at this time. And next, I'm going to talk a little bit about healthcare capacity. So this map is showing you the healthcare capacity across the state. It's basically just showing hospital beds, ICU beds, staffing. This is posted on the Montana DPHHS website, and I believe that they are putting it into weekly reports as well. So what we want to talk about is, we know that we are a healthcare hub here in Missoula County, and we are going to have people hospitalized here from some of our surrounding counties as well. But we need to also be aware that, cold and flu season is also going to put a strain on our healthcare system, which is why it's so important, again, that we take all of those preventative measures. Keep your social circles small, make sure that you're practicing social distancing whenever it's possible, wearing masks out in public. And even when you're around people that you know well, like your coworkers and friends, it's still important to practice those measures, because we don't want to put a further strain on our healthcare capacity. So what comes next and what can we do? Right now, Montana has one of the highest rates of transmission and case rates of any state. I believe we're currently ranked 3rd in the nation. So we need to act now as we head into cold and flu season. And just a reminder that all of those interventions, we want to use all of them whenever possible. 6-foot social distancing, wearing that mask, frequent hand washing, And even if you have mild symptoms, it's really important that you get tested. And a reminder that all of those interventions are not only going to prevent you from developing COVID or passing it on to someone else, but it's also going to help prevent the more common cold and flu as we move into the colder winter months. And again, even if you have the mildest symptoms, it's very important that you get tested because, as you can see from this chart, there's a variety of different symptoms associated with COVID, and some people only have 1 or 2 of those symptoms and they end up having COVID. So you're not going to be taking a test from someone else. Please just get tested if you're having any symptoms. So with that, I will turn it back over to Mary and we can answer some questions for you.
Yeah, thank you so much for that wonderful presentation, everyone. I think we will try and take questions, of course. So whether you want to send a message in the chat box and just let us know that you have a question, or if you wanted to hit the participant button at the bottom of your screen, it opens up that window and then you can raise your hand. All right, looks like Madison has a question, so please, you can unmute yourself, Madison, and ask us what you'd like to ask.
Hi, Mary, thank you. Madison Donor with KECI. The state just reported 932 new COVID cases. That's a daily high for Montana now, and I know that earlier we mentioned that Missoula County has seen an 89 new cases, and that's our new daily high. Is there any recommendations from the health department on maybe what this might mean for restaurants, bars, or other establishments here in the county?
Yeah, that's a really great question that I think is most appropriate for Cindy to field. But if I'm incorrect, please correct me.
Yeah, I believe that Ellen is actually on this. Ellen, would you like to answer that question, or do you want me to take it?
I can take that question. We are actively in discussion with the board's COVID committee, and that was last night, looking at all of our indicators. And we'll be meeting with elected officials, schools, and other leaders who I meet with every week, and looking at this data trends and some of our indicators, and also being aware that the governor is not issuing any additional restrictions. And so any additional restrictions need to come locally. So we are formulating some proposals, and we'll probably have announcements next week related to those.
Thank you, Ellen. I appreciate it.
All right, excellent. I see that Cameron Evans also has a question, so let's go to Cameron next.
Hi. Yeah, I was just wondering if you could address how many cases have been tied to senior living or retirement homes.
Yeah, I think if Ellen is still unmuted. So Ellen, how do you feel about addressing that question from Cameron?
So I don't know the actual proportion as of this moment, but it is a significant slice of active cases. If we looked at historical cases just in this particular spike, it's significant. It's not as high as half or even a third. It could be, a fifth, but they are continuing to add cases, unfortunately, because regardless of the restrictions, and you might recall we put additional local health officer restrictions into place in Missoula County, I think a week or a week and a half ago. No visitation, no new admits, things like that. It's just a very, very difficult environment in which to control spread. There's not a way for folks to reduce capacity, obviously. the care that's required. There's not a way to reduce the level of care, and yet the staff are often in a situation like this also infected or in quarantine. So I do expect more cases, unfortunately, in that highest incident age group right now, which is 80 and older.
Thank you. Do you mind if I have one quick follow-up?
You can go for it.
Yeah, so I was just wondering, also, and I don't know if I missed this, if it was touched on, but in terms of the new cases and hospitalizations, how much capacity we have in hospitals right now, and if we're expecting to also continue housing more out-of-county residents in hospitals.
I can take that question. So right now, we know that the hospitals are still performing elective procedures, and they do have the capacity to be able to continue to take additional hospitalizations. They are looking at that workflow within their hospitals and keeping an eye on that. And we do expect that we are going to continue taking people from other counties, as we are a regional healthcare hub.
Okay, great. Thank you.
Yeah, you bet, Cameron. So there are a few folks that have their hands raised in the queue, and so I'm going to go to those folks first, and then we'll circle back to some of the chat questions. Griffin, I see that you have had your hand raised. Did you want to unmute yourself and ask us a question?
Yeah, that'd be great. Thank you.
Of course.
Specifically at the University of Montana level, I noticed that cases have dropped from over 100 to now just 56 active cases. I was wondering if anyone could detail why cases appear to have dropped off among university students, faculty, and staff.
So this is Ellen. What you're seeing, if you were looking at that as an epidemiological curve, as you saw for the whole county earlier in the presentation, you see that that curve went up, flattened, and then has gone down, has not completely gone away. That's exactly the kind of curve you want to see when suppression is working. And on campus, even when the curve was going up and the cases were ascending, as we started to gather information about where transmission and exposure was happening, it was happening in the less structured areas where we may not have the 6-foot distancing and the masks. So it's the areas outside of the classroom and outside of the dorms. And one of the first things the university did when they started seeing a spike was to pull back on their extracurricular activities. So those are some areas where you're going to see more spread than you would out of a classroom. So those particular suppression efforts had some level of effectiveness at the university. The other thing that's going on is whenever there's a spike in the 20 to 29-year-old age group, not at all limited to or created by the university, these happen all over the country, that same type of transmission pattern starts to decrease in that age group and moves into other age groups, as you saw in the earlier pie charts. And as we move away from that 20 to 29-year-old age group as being a preponderant age group at U of M, then you also see those figures decrease. But a lot of good structure and mitigation measures had a lot to do with that situation.
Great, thank you.
All right, thank you, Griffin. So next up in the queue is Katie Miller, if you wanted to unmute yourself and ask us a question.
Yeah, thank you, Mary. I'm with KPAX. This is a question for Ellen or Cindy, if you guys know. I'm just wondering how many businesses have closed due to order of the health department?
So recently, we did have some closures much earlier in March and in the shutdown, and then in phase 1 and phase 2. And those are just basically closures from businesses that weren't supposed to be open at all. There was a handful. But since that time, we had not had closures until recently, as we saw our cases going up, and also we had done an awful lot of work with working toward compliance and then being on-site inspections. And I am counting 7 in my head right now, with 1 perhaps by this morning, 2 having reopened. We do have others that have been put on, been issued a compliance order, which is the last step before closure.
Thank you.
Does that answer your question, Katie?
Yes, ma'am.
Okay, perfect. Thank you. So now I'm going to bring our attention over to some questions that have popped up in the chat. First, we have one from Rob Watson, who asked if we could speak to the new guidance from the CDC that was released today about what's considered to be a close contact. And I've already indicated this in the chat. Oh, this was a private message, so I'm sorry you can't see it. But Rob was curious if we could speak to those new guidelines from the CDC regarding close contacts. And it is true, they did release some new guidelines today, but the information that they shared today is actually how the health department has been classifying close contacts this entire time. So the CDC guidelines that were released today are better viewed as a clarification on their end from the way that they were approaching things. But the health department, it's been standard practice to consider a close contact as someone that has been in close proximity to someone else that has tested positive for COVID, and they were near that person 6 feet or less for a cumulative amount of time of 15 minutes or more. And I say cumulative time because it could be a series of disparate interactions, but over time, like maybe over the course of a workday, they would have accrued at least 15 minutes or more of close contact with a known positive case. And then hopefully that satisfies Rob's question. And then next up, this isn't a message that everyone can see. John has a question, and he would just like one of us to review the requirements for quarantining once a person comes into close contact with a positive case.
So that would be Cindy.
Yeah, let's get Cindy on the horn again.
Yeah, so the requirement is that if you are identified as a close contact to a positive case, then you are required to quarantine for 14 days after your most recent interaction with that person. And so sometimes that's really hard because if that person that tested positive is a household member, then you really need to be able to separate yourself from that person in order for the clock to start on your 14-day quarantine time. And quarantining means that you do not come into contact with anyone else. You don't leave your house. You don't go to work. You don't go hang out with your friends. It means you absolutely isolate yourself for the full 14 days after your most recent interaction with an infectious person.
Yeah, so does that answer your question, John? Do you feel like you've got that dialed in?
Yes, please. Thank you.
Yeah, you bet. And Patrick let me know that in addition to the CDC having their clarification, a component of that too was that it could be over the course of 24 hours of exposure. So we're looking at a cumulative total number of minutes is 15, and you're looking at accruing that 15 minutes or more over a 24-hour time period. So thank you, Patrick, for clarifying that in the chat for me. Any other folks have questions? Not seeing any hands raised that were not already raised.
I do see a question in the chat, if I could respond.
Yeah, absolutely. Thanks for the extra eyes.
Do you know if there are any plans in place for travel restrictions? I am not aware of any plans, either from the federal, state, and certainly I can speak for the lower local level. Travel is important for original introduction into a community. It's also important for people who are actually leaving the state or even going from county to county, as we see in our state. When you look at our overall types of transmission though, travel is running at about 4 to 5% as the cause of or the source of transmission. So it is not a large segment as a source of transmission.
Thank you, Ellen. And Cameron, it looks like has a follow-up question, or rather a separate related question about trick-or-treating and Halloween. So I don't know if Ellen or Cindy want to speak to Halloween in general.
So Mary, you put some things up just for the younger age group. Maybe you could point out to where those live, and then Cindy or I could talk about, I think, a more worrisome age group.
Okay. Yeah, so of course, this is a really timely, relevant question that Cameron is asking about. A lot of folks are wondering what's the deal with Halloween this year. And really, we're encouraging folks to kind of have a shift in your framework of what a Halloween is going to look like this year, because safety continues to be a priority. And so working in communications with the health department, we have some really wonderful community partners, including folks in communications at the University of Montana, as well as at the city government from our Joint Information Center partnership. And through that collaboration, we have created some messaging around Halloween safety for kind of the young kids. The health department has not started that sort of messaging campaign, but it is in the works. And so you'll start to see some messaging around Halloween and safety for the little ones coming out probably starting today and tomorrow, but moving and continuing that messaging push through toward up till Halloween. And again, we're really just reminding folks, if you are going out and about, that you should be wearing a face covering in addition to a mask. Or, we also, of course, want to be sure that folks are still able to breathe. So maybe you are wearing your face covering and you incorporate that creatively into your overall costume. So we certainly don't want people putting a mask on top of a mask and not being able to breathe. But it's really absolutely important that folks keep wearing the cloth face covering as they're out and about. For folks that are going out in groups, we would really encourage you to keep it small and keep it to what some of us at the health department kind of call like our COVID circle. We all have kind of identified a small group of folks that are friends or friends that are family or family. And those are the folks that we continue seeing throughout the duration of kind of this pandemic. And so we encourage folks to kind of maintain those same smaller social circles if they're going to celebrate Halloween together. If it warms up, we really encourage folks to go outside and take your festivities outside. And I want to pause for the cause and let Ellen talk a little bit about the younger adult demographic that also might be considering some Halloween festivities.
Well, it is on a Saturday this year. We know Halloween is, particularly since we've been restricted, a time where people do wish to go out. So in addition to what Mary has stated, really think of it differently. We are giving this virus to each other, the people that we do know. And so a gathering in an apartment or a house for Halloween will spread. It will spread in the high school, the college age, in the 30 to 39. It will continue to spread. It is present. So really, should not be having parties that are anywhere large or crammed. Go to the structured activities. U of M is putting on some structured activities. There's some other structured activities in places in the community. Go to those, go outside, and do not have a large party. And whatever size party you have, try to keep the households that are represented in that to actually 3. That's pretty small. And masking. We are at a precarious point of being able to slow the numbers. And this next week, we're going to know a lot more about whether we're going to be able to do that or not.
Thanks, Ellen. And then could you just remind the folks in this space what the current size limits are for group gatherings?
Well, currently it's the governor's directive of 50. And we are working on locally, since the governor won't be making changes to that size limit, we are working with our advisors and our data to determine how much smaller that needs to be, because it's too large for this transmission rate.
Mm-hmm. Yeah, thank you for reminding us of what the restriction sizes look like right now, and that extra reminder that while that number is high, it's kind of too high for current circumstances. So really, really encouraging folks to keep your social circles small. And particularly, as Cindy alluded to, so many of us, just by the jobs that we might have, we just naturally inherently come into contact with more people. And so if we can sort of really keep an eye on our social circles, that will help kind of balance out the possible number of close contacts. I do want to be very mindful of time. It is 11:17. We said we would go to about 11:15. There is one more question from Healy in the chat box, and so maybe we'll take that as the last question. And then I don't know what folks' availability is, but we can probably hang around for a few minutes if other folks have questions that they want to address. So Healy wants to know if we have suggestions for students who are breaking out from the masks. Could you clarify what you mean by breaking out, Healy?
Yeah, we just have, especially in our younger students, we have, we have a couple kindergartners and then several teenagers, about 4 to 5 in our school, who are having, it seems to be like causing acne type reaction.
Oh, like a rash? Okay.
Rash, stuff like that. So just any suggestions about how to prevent that?
I think that the biggest suggestion I would have is frequent cleaning of those masks. It's really important that those masks get washed, whether they get washed with the regular laundry or hand washed and hung to dry. That's the most important thing, is making sure that they're being frequently washed and sanitized. And when we say frequently, every day. They need to get washed every day. And that's probably the best suggestion for that. Unless, Ellen, do you have something that you want to add to that?
I would just stay away from harsh chemicals such as bleach. They don't need to be bleached if you put them in a hot dryer to dry them for 15 minutes. Those types of things are very irritating to skin that's already irritated. Some students may need to have 2 masks per day if they're getting too moist, and you may have to wash 2 of them a day. But those are the types of things that actually can make a difference.
Yeah, thank you. So there is one more question from John in the chat, but I will go ahead and say that this is fluid and dynamic, and we do not have an idea of what a timeline would be. Ellen was just sharing some of the things that are kind of in motion, or things that have been some conversation pieces about some data-informed decisions that we can really make in the community to reduce opportunities for COVID exposure and transmission. So with that, unless any of the other presenters or Ellen has a final thought.
I just want to thank everyone who tuned in and is getting this information to the public, and also thank not only the members of our team here at the health department, and Mary for hosting this, but also it is really unique and highly valuable that through our academic health department, between MCC, HD, and the University of Montana's School of Public and Community Health Sciences, that we have the epidemiological expertise that has been working since March to be up and ready to be informing us and consulting with us at the level that you've seen today. Thank you for that.
And my one last thought that I want to put out there is that I just want everyone to remember that we are still seeing a big increase in cases. We got 89 new cases today. That's a record for us here in Missoula County. So it is important more now than ever to take those precautions. And I know everyone is tired of hearing me say it over and over again, but the 6-foot social distancing, wearing cloth face coverings whenever you're even around people that you're friends with or your coworkers, frequent hand washing, all of those things are the preventative measures that are going to help us get control of this virus. So it is just really important that people remember to continue those safety precautions. And thank you to everyone who is here and everyone who presented.
Yeah, awesome. Thank you.
I just had one more thought to kind of what Cindy was saying, and the CDC guidelines came up, and I just think it's important to mention that these are just that, they're guidelines. Everybody is in a different situation with our social interaction. And so we can't be counting up to 15 minutes of social interaction a day and saying we're fine. The point is to limit our social interaction as much as possible. And the 15 minutes is where, they've seen if it's more than that, we might have more of a chance of becoming infected, but that should not be a strict cutoff. You could be exposed to a close contact to someone for a lot less than 15 minutes and still have the potential to become infected. So just keep that in mind and be careful in general and take these guidelines as guidelines, but really try to reduce your interaction as much as possible in general.
Yeah, thank you, Ethan. That's a really wonderful reminder and a really great way to close out this press conference. Thank you to everyone that presented. Thank you to the folks that attended. And I know that we'll be in touch. Hope everyone has a wonderful rest of your day today. Take care.